this Public Health Subcommittee meeting to order at 9:03. Stand for invocation. Frankie, release and prayer, please.
Heavenly Father, we thank you for this day. We thank you for the many blessings that you bestow upon us. And Lord, we ask for your guidance and your direction as we go through this meeting. In Jesus' name I pray. Amen.
Okay, Shelley, roll call, please.
Sir. Mike Dobbins.
Here.
Bill England.
Honey.
Keith Austin.
Here.
Harley Buzzard.
Here.
Rex Jordan.
Here.
Mary Bakershaw. Honey. E.O. Smith.
Here.
Denise Taylor. Here. Victoria Vasquez.
Honey.
Brian Warner.
Honey.
We do have a quorum. Is there anybody here this time that wasn't last time that want to be a member?
Yeah, I'll get on.
Is that it?
We will not have to approve the minutes, as you probably didn't know it, but you passed the minutes yesterday in Health Committee. All right. Yeah, we're efficient. Okay, we'll start with reports. Dr. Gann.
Thank you, Dr. Dobbins.
I'm going to join him up here, if you
Okay.
don't mind. And
All right.
Chair, do you mind if I say something?
I don't mind at all.
I missed the first one of these public health subcommittee meetings because I was, I don't remember where I was, but somewhere in my travels I was gone and wasn't able to make it. But I wanted to thank both the administration and the council for forming this subcommittee. We have a relatively limited amount of time in health committee, and we spend a lot of it talking about our health system, clinics, hospital, and those sort of things. Contract health service, prescriptions, things like that that are certainly important to people, and they're at a point in their health of, needing those sort of things. The sort of changes that you can make with public health efforts and being before policymakers and lawmakers such as yourself are huge and immense, and can have far-reaching effects, more so than what we can do within our clinics and hospital. And so I just wanted to thank you all for giving us additional time to educate you and work with you on some of the health issues within our population, and some of the things that we might be able to do to affect those over the long term. So thank you, all of you. Now where did Dr. Gann go?
So Dr. Dobbins asked me to come speak briefly about the issues in the news about the life expectancy in Adair County and Stillwell. So I'm going to take a few minutes to go through that with you. I put some paperwork on your desk. So in September of this year, CDC put out this report, and you have a copy of it. It's called the U.S. Small Area Life Expectancy Estimates Project. There's a new body of science that's evolving over the last 10 years on ways to estimate health statistics in small populations. It's not too difficult statistically to figure out a smoking rate for the United States. You sample some people and it's relatively accurate. But as you go down to smaller and smaller populations, the estimates that they come up with vary year to year quite a bit. So we use statistics mostly in public health to monitor trends over time, and then to also find areas where we need to focus. So the Washington Post picked up the story in here that Stillwell had the lowest life expectancy in the United States, and it continues to cause quite a splash. And so if you, this study is very hard to read once you get past the first 2 pages in the introduction. It's a lot of math and science and statistics. And the author's purpose of this study was to test some new methods that hadn't been done before, building on previous science, to estimate life expectancy at something called the census tract level. Census tracts are stable geographic areas that the Census Bureau uses to talk about demographics and population issues. Never been done before. And if you look at the results of the study, the authors state very clearly, based on the purpose, that they produce statistically reliable abridged period life tables. So if I can refer you to the map. So there's a map of Adair County. It looks like this. In Adair County, there are 5 census tracts, and I labeled those 1 through 5. The area in question that made all the news was census tract number 4. The 4-digit numbers on there are the official number of the census tracts. This study developed estimates for 65,000 census tracts in the United States. The 3-digit numbers are the estimated life expectancy. So you can see that in that census tract that includes Stillwell, the life expectancy was 56.3 years, starting at birth. Right? That's the life expectancy. And you go 20 miles either way, east or west, and it's significantly different. If you look at this table, right, this lists the 5 census tracts in Adair County, and just gives you a brief look at who lives in those census tracts, the number of people, the races, the age groups, the gender. And at the very bottom, it lists just some socio-demographics about those people. Dr. Comerford put this table together. I'd like to thank her for that. And what's important about if you look at the map, the 5 census tracts, when the researchers put these numbers together, they split the population into 11 different age categories. They found the death certificates, put those on a map to assign them to a census tract, then calculate a mortality rate for each age group over a period of 6 years. If the number that they came up with was too far off of what they expected, then they changed it from what they observed to what they expected. Or if there were no deaths in that age group, they replaced the number with an adjusted estimate based on some other census tracts. So of these 5 census tracts, number 1 and number 2, some of the data they replaced with what they expected and not what they saw. They don't say how many. And then on 3 and 5, the census tracts to the east and west of Stillwell, they replaced all the data with what was expected. What they found was too far off of normal. I know, right? So, but in the Stillwell census tract, they use only observed data. Now, these data are adjusted for population characteristics to make it easier to compare. As a public health department, the way we use data like this, number one, the authors achieved what they wanted to achieve. They tested out a new method, they put it in a peer-reviewed journal, and now other scientists who do this for a living will continue to build on it, will critique it, and find even better methods to make these estimates. I can't say that we learned anything new about Adair County based on this study. The wrong thing to do would be for us to go to the doctors in Stillwell and say, you guys got to step up your game, right? That's not what's going on. We know that place matters, and these data emphasize that to us, that we know that place matters. It's not true that if I move out of Stillwell and move to Bell, I'm going to live 20 years longer. I mean, you've been to Adair County, it's just not like that. What it tells us, what we already knew, is that we have work to do in all of our counties. We have our tribal tobacco settlement endowment trust group working there, doing a lot of hard work with municipal leaders in the schools, in the communities. When we look at data, this type of data, and we're just looking at an endpoint, right? Mortality, death. The question is always, well, why? You know, what's causing it? And so we take one more step back, and I gave you another graph with all the bars on it. And it looks like this. And this is all races in Adair County over a period of 3 years. And the top graph is the counts of the causes of death. And I showed Counselor Crittenden something similar to this when we went to Stillwell. And then the bottom graph is years of potential life loss. I believe I've shown you something like that before as well, where we use the age of 75, and if someone dies before the age of 75, we count all those up. So it's not just what people are dying from, it gives you an idea of how old they are when these people die from different causes, but also the impact on our community. Just over a period of 3 years, over 2,000 years of potential life loss before the age of 75 from heart disease and stroke. I lump those together because the disease process to lead to those and the factors that cause those are the same, heart disease and stroke. You can see accidental poisoning has a relatively high years of potential life loss, but the number of people in the top graph is only 15. That means it's younger people who are dying from accidental poisoning. Accidental poisoning includes drug overdose. So then you look at the cancer rates and all that. So as a public health department, as a health service with limited resources, where do we need to focus? Yeah, Adair County, we need to work. And what about Adair County do we need to focus on? The causes of heart disease and stroke. Right now, we're working with University of Oklahoma Health Sciences Center, the Department of Epidemiology and Biostatistics on a report on heart disease in Cherokee Nation. And it's going to be an in-depth look of all the data that we have as we develop our strategic plan that we're in the process to see where we need to go to work. So Dr. Khan, who you know leads our institutional review board, brought up a good point. When we take a step back, what are the 3 factors that influence how and when we die? And there's the genetics that we're born with, there's our environmental exposures, and then there's our health behaviors. We spend a lot of time focusing on health behaviors. And I mentioned last month, it's cigarette smoking, lack of physical activity, and nutrition, all placed in this behavioral health environmental cloud that we can't measure very well. So that's where we work. We work on smoking policies with municipal leaders, 24/7 tobacco-free schools, safe parks, sidewalks, safe routes to school, community gardens, school gardens, all those things to work on those health behaviors. And with the audience that y'all have as leaders, to get up and all the speeches that you make and all the meetings that you have, you just start to mention those. It needs to become a common theme. It wasn't that long ago that I would ride in the back of my car with my parents with the windows rolled up, no seat belts, with both of them smoking. And now that's just absurd to think about it, and it's because of the message over a long period of time that that's not right. Even things that seem simple, last year in the United States, more people died from influenza than from car wrecks. So how do we get people to get their flu shots, right? Most people are wearing their seatbelts. But drinking and driving, you can see on this list, motor vehicle accidents didn't even make the list. So we made progress there. The way I think we should approach this study when people ask us, are these numbers real? I've been trained to talk like a scientist, right? So yes, these numbers are statistically reliable. That doesn't mean much to the mayor of Stillwell or the principal of the elementary school. What it means is that place matters. We know we have work to do. We have the tools to communicate the messages, and we're there with the people trying to change those health behaviors, monitoring the environment, and providing the services that we can. Any questions for me on this study?
Doctor, thank you for doing this. You showed me this a couple weeks ago, some of it anyway. You hear lots of folks talking about this. Just to make sure I'm understanding. Now this Stillwell popped up I mean, that's out of every little town in the United States.
65,000 census tracts. Yep.
Okay. And how accurate do you think these the census is?
So I mentioned.
I was looking at the race here. How accurate, generally, how accurate are the census?
The number of people is pretty accurate. For racial classification, that's self-reported race, and we're not really sure how accurate that is. We're working with the state on some of the surveys that they do. They'll ask, what is your race, and they'll give an answer. But we want to ask them, do they hold a CDIB card, regardless of what they say for race. There's quite a few people that we haven't been able to count that do not self-identify as Native American, but are our beneficiaries to our health services. So I don't know how accurate the racial classification is. Now notice that in the census, they do have categories for multiple races, where people can report that. But what we have reported here are people who say they're white or they're Native American without any other race is the majority there. Then you see that multiracial category. And all this data is publicly available. There's a website called County Health Grades. You can pull up any county in the nation. They give you these estimates. So I think it's pretty accurate. Now in the study looked at deaths from 2010 through 2015, so 6 years. So in 2010 is the year that they do the census. So when they estimate the population to calculate those death rates, after 2010, they use a survey called the American Community Survey, which is just a sample. For the census, they go and they count everyone that they can. For the American Community Survey, they do a sample and they estimate the population for those other years. So there's an area for error in these rates. We don't know how many death certificates were not counted because they couldn't place them on a map. Dr. Comfort and I know when we send a pile of addresses to David Justice in our GIS department, we'll get many of those back, but they can't find them on the map. So the report doesn't state how many of those, how that happened. We don't know how many people might have an address in Stillwell that don't live there. So they get counted in that census tract.
I heard about that. So I was asking you yesterday, just from the medical side, it would make me feel better as a resident of Stillwell and my family. Compared to Jay or Grove or Tahlequah, is there something that sticks out medically in your data that says that Stillwell just stands out, or from the different clinics around, pretty much the same? The diseases and
they seem to be. I think it's more important to look at the determinants of those diseases than the diseases, but nothing really pops out.
because my folks, they hear the headlines and they read them, hear it on the news, and I appreciate your data. I think what I'm trying to get is it's like we're approaching this really carefully and almost careful to take it really serious is kind of what I'm gathering. And I know you're taking it serious, and I
Yeah.
appreciate your work, but the conversations that have been had, there's no real panic in anyone's voice so far, and that's what I'm trying to get at. I mean, this is a
Sure.
study where my hometown, out of a lot of hometowns,
Right.
placed at the bottom. And is there, from your work, is that something, from your profession,
Right.
that we should, by golly, be alarmed?
I think we're not having the same reaction as you because this didn't give us any shocking information.
Well, now,
I know what.
now,
Well, look,
now that, right. Frankie, did it shock you that our little hometown, Stillwell, Oklahoma, is the Washington Post?
Yeah, so we know what the smoking rate is, and we're doing everything we can to help people to stop smoking.
But
And so now the other difficult time we have is if we use our healthcare data to try to estimate population health. You see the report, what percent of people in Adair County are beneficiaries of our health system? Maybe half. So there's another half of the population that our health services don't reach. And so to use our Cherokee Nation Health Services data to say this is the diseases happening in Stillwell or Adair County doesn't work well for us. Now, we can look at, the counts of the number of people with diseases in our clinic and make sure we're meeting those needs. But from the public health perspective, we got to go back before they get sick and try to prevent them. That's where prevention is so important. So, we take this report very seriously, and it's very important to us, but it goes with the information we already know. We have a lot of boots on the ground in Adair County, and we know that the smoking rates are high. We hear stories.
higher than New York City?
Yes. And we have those estimates. So when we're using statistics to make decisions, it's the best information we have. We have to interpret those appropriately to make the right decisions. So when we help a school become 24/7 tobacco free, doesn't make the news. When the city puts in a new sidewalk and lowers the speed limit, that improves people's health, and it doesn't make the news. And that's okay. That's what public health is. We're kind of behind the scenes trying to help out. So you don't take the numbers too literally. There's other counties that are 56, 57, 58. To say that they're different than Stillwell, that's not the purpose of the study. The purpose of the study wasn't to figure out which census tract had the worst mortality. They were testing new methods to see if they were reliable. And from the scientific point of view, they were pleased with their results. I think the Washington Post was very careful the way they reported the numbers. All they said was, according to this report, Stillwell had the lowest life expectancy in the country. That's not what the report said. That's not what the author said. The authors didn't say the census tract that includes Stillwell has a lot of work to do. They just published their findings, focusing on the methods that they used to get to these numbers. And it's a beautiful paper. It's a real scientific achievement, what they did from a statistician's point of view. And the experts will continue to review these methods and improve them to figure out how to do this. Because from a public health perspective, we know that place matters. So, up your alley, look at the percentage of adults greater than 25 years old with less than a high school education. So it's 1 out of 5. It's a bottom line on the table. That doesn't fall under Dr. Grimm's work to do, right? That's the education department. So we should support that, knowing that keeping kids in school improves their health.
And I will say too, let me add some things now. Did the information when it came out startle us? Of course, whenever it says we have one of our communities that has the lowest life expectancy, we go, what? But whenever you see us target, programs, some of the grants that we get through our public health department, it is rare, and I don't even know if we have ever not targeted Adair County, because of some of these issues that we know about, the obesity rates, the smoking rates, and things like that. The other thing that the tribe is doing on a broader perspective, I think you all have heard us use the term social determinants of health before. And that encompasses a lot of things besides just the access to health care. And two of those big ones are on the graph or the table that Dr. Gann gave you. Poverty or socioeconomic status and education. And, you know, the tribe, although you don't hear it phrased this way very much, the tribe is tackling things in a very comprehensive way that looks at the social determinants of health. Whenever, you know, the chief and the administration and the tribal council makes monies available for scholarships, you know, any youth that grows up in Stillwell, you know, is guaranteed a $2,000 a semester scholarship if they want to go to college. And one of the things that affects health status is educational level and socioeconomic status, you know, the ability to get a job. I mean, the research has shown that those things help. Another public health thing, environmental things, you know, a lot of safe water and sewer projects that we do across the nation, you know, under tribal funding and or federal dollars coming into the tribe. So, I mean, the jobs that we try to make available, you know, for our population, as well as the increased access to health care. That's important because once either preventive health or, you know, the health care that you need once you get a disease or are sick is important for both your quality of life and longevity. But a lot of these things that we're dealing with, you know, cigarette smoking, poor nutrition, lack of physical activity, those sort of things that Dr. Gann mentioned are things that sort of through policy areas or programs that we do, you know, in the schools. One of the things that he talked about was design a town, you know, or as you're making renovations to a town, and you decide to make safe sidewalks or bicycle paths, you know, things like that to encourage people and make it an easy thing to do are the kind of things that we don't always get to talk about, you know, in bigger health committee that are important, that'll make long-term impacts in our communities. In fact, he mentioned one thing that I think it would be nice to give you. The state health department puts out a county by county, you know, set of statistics. And they are not as small population level as this. They are county level statistics, and it would be, you know, at some point good to give you our 14 counties, you know, as a handout in this committee that shows you some of the differences, you know, that the state measures between our counties. So I don't want you to think we're not taking it important, but we know that some of the statistics in some of our counties are worse than in others, you know, that we track. And we do an adult tobacco, you know, survey, and look at that because it is one of the most preventable, you know, causes of mortality and morbidity out there. And we try to work on those things, you know.
Does health work with the environment, folks? You know, we have the landfill there, and there's a creek supposedly right when you cross over from Arkansas into Oklahoma. Supposedly, I hadn't seen it. A friend of mine, he's a pretty sharp guy. He says there's a sign this water is contaminated and do not swim in it, and you know, don't bring your families here. Supposedly, at the state line, you know, there's picnics set up everywhere, and you know, that kind of stuff. The water thing, the poultry thing that's going on right here is kind of could probably fit into some things, but in our area, you know, there's lots of things. So you have been kind of hand in hand with the environment. And my other question is what is the plans from the health side of it as far as, you know, the obesity rate? You know, I think I mentioned it the other day. One of my bosses came to me and said, "Hey, I hear we're getting a health facility in Stillwell, and Cherokee Nation's going to help with it." And, well, it'd be nice, but I hadn't heard a dang thing about it. And you know, so what are some of the conversations that we can take back to our folks about what's going to be done? And it's hard for me to wrap my head around.
So let me,
Now, I haven't read this, but let me make sure that I've got this. This study covered the United States, right?
Yeah, it excluded Maine and Wisconsin because they didn't have geocoded death certificates for one of the years. But yeah, most.
Now, and so that's a lot of states. So,
and it did it by census tract, you know, as Dr. Gann said.
All right,
It
so-
didn't do it by county, you know, because
All right.
within Adair, there were 5
Census-
census tracts.
All
And,
right.
and the other thing is,
Adair County, I have a map of Adair County.
you know, they did not try to attribute cause to
I
any
got
of
it.
this stuff. They were just
I got it.
testing, trying to test a methodology. And it certainly is making us look and dig into these things. But I mean, when you talk about
Help me out here on
cause,
this census tract. So we're in 4 right there, is that right?
Yep.
Now census tract, does that stretch, where's the bigger map?
Do you see the white line around the 4, that white border? That's the census tract.
1, 2, okay, that's our census tract, all right? So, we just got to start out on, you know, how high does these tracts go?
What do you mean?
Well, we're 4. Is there 5, 6, 7, 8, 9, 10, 11, 12, 13,
Adair
14?
County, there's just these 5.
Okay.
In the United States, there's about 70,000 census tracts.
Now, help me compare that. So let's say a county in Texas. All right, so they looked at that too, right? A county in Texas? And that county had so many tracts,
Correct.
right? And Stillwell, every state they looked at, right?
except those 2 that he mentioned.
All right. So, you know, I've seen this and I see some kind of looks like shut the heck up, but we're here at this committee meeting and I've seen some headlines. You see headlines on Facebook all the most time I scroll through them, you know, but I knew we was gonna visit about this. I've got, you know, what if it was, you know, Jay, you know, I know that,
I think this is really important for you to understand and for all of you because, you know, you're all legislators for the Cherokee Nation and people see this in the press, have seen it in the press. They're going to ask you about it and expect you
Exactly.
to know about it. We want you to understand it.
All
That was
right.
one of the reasons we pushed it from yesterday to today so we could have a much longer, you know, discussion about it. So
but this.
you don't need to, I
Right.
mean, I hope nobody on my staff's looking like you
Well,
need to be quiet because
well,
that's
this-
why we're here today to
Right.
talk about it, you know.
But
And-
this study is saying, this study that, you know, is scientifically done right, towns in Florida, Stillwell, Oklahoma, is supposed to be worse than those towns in Florida, right?
This study is saying location matters is what it really proved, and we know that, but they've never done it really at this level on a big scientific basis across the United States to try to get down and predict mortality or death rate. You know, there's an example of a speaker that's going to be coming to speak at the NORA you know, program coming up that Counselor Shaw introduced us to, a group called the Lynn Institute, who's been working with Oklahoma City, the city of Oklahoma City. There are 3 zip codes. They were looking at zip codes at that time, not census tracts, that have some of the worst health statistics in the state. And they are in Oklahoma City, adjacent to some of the, you know, richest areas in the city and or the state, you know. And so they were looking at the things that were causing that and trying to improve those, you know, issues to try to improve the health of the people in that population. And so what it's telling us, and Dr. Gann can correct me if I'm wrong, because you can hear he really understands this to a depth that few of us do. But where you live matters about your health, and there are reasons, some reasons we know about, probably others we don't. You mentioned some environmental concerns. Environmental concerns are issues that affect your health, but as I look at environmental concerns and I look around the rest of this county, and see that, as Dr. Gann said, 20 miles this way and 20 miles that way, the numbers are different. And these were estimated numbers because of some reason the authors used. And they used real numbers, in this number 4 census tract on this map. And so I wonder if it was environmental issues. That's not very far apart, for some of the things you mentioned. Why did it not affect some of these others? But there's probably exploration to be done on that, and we're not going to ignore it, as a tribe. And you ask the question, do we work with the environmental program? Anytime there's an issue that they raise to our attention, that they want our involvement, we absolutely get involved with them.
In your profession, and what's your thoughts on the landfill? Are you interested to see, by golly, is that causing some health issues?
Sure. Yeah. But our environmental health programs are outside of health, right? But we work with them routinely, and push that to them to see what's going on. The air quality, water quality are important determinants of health. So, yeah.
So
very
those
interested in all
studies and conversations are not that that's your responsibility, but
Well, we often start out with an opinion, right? That, man, I wonder if those chicken houses really are having an effect. Then you go out and you study it and you gather the data to help, support or refute what your concern is. And there's so many factors, right? It's really hard to measure rates of depression and PTSD. Very difficult. Seems simple to measure water quality, but water quality changes routinely through the year with the amount of rain and all that. So, and then to determine how many people are exposed to that, and then determine, does that exposure cause these diseases? Is that causing the lower life expectancy? So putting all that together, it's
Very
a lot
complex, yeah.
And we're looking at it all. We have
I'm gonna wrap my questions up, but where does the census tract? Now, is that the census we all get in the mail and fill out? Okay. Where else can they get this info? Is that the only place through the census?
the population numbers.
Well, all of this race and where's this information coming from?
Right, so that's a combination of the census, which they do every 10 years, and then a continuous survey called the American Community Survey. And the real difference is that for the census, they go and count everyone. The American Community Survey, they take a sample of people and estimate the rest of the population.
If I may, need to move on. Counselor Warner.
Yes, sir.
Sorry, Sean.
Hey, wait, I need to get my questions answered here, sir.
Okay, or do it after the meeting, but go
Well,
ahead.
okay,
We got 3 other people who are gonna be talking here.
all right. So, the census, I'm not sure in my area, believe it or not, I've got quite a few friends. And we've never had a census filling out party, never seen anybody fill one out. I bet they do. But I'm kind of skeptical of the numbers. I know there's a problem. Just looking at some of these things, and like I said, I'm going to wrap it up. But it's very alarming to people, and I wanted to make sure, I kind of understood what it was saying. So it's a bad deal. You two didn't create this. It's not your fault, and it's, so I hope you don't perceive what I was saying as negative. But I guess where I'm at is, It looks bad. Cherokee Nation's role. Now, Cherokee Nation didn't adopt Stillwell, so not your responsibility to come in and fix it. But of course, we're expecting, some help that's already been given. I mentioned obesity, the smoking thing. We've got some behavioral health things coming up in the near future. So just real quick, some of the big conversations you're having about coming to that neck of the woods and trying to make some improvements, Cherokee Nation wise.
Go ahead.
Councilor Crittenden, if I could address, because I too, when I first saw the article, being originally from Peavine, it caught my attention. First thing I did was got on the article the day it came out, within hours, put in my home address at Peavine to see what my life expectancy was supposed to be. Came up in the 70s, confused me, so I immediately emailed the author of the article at the Post. He emailed me right back and did not have a lot of insight into those whys. So that's why we started digging a little deeper. And I would say that we're still digging. We're still trying to understand why the differences, because I'm from there, I know that going from Stillwell and driving 6.2 miles out to my mom's house is not going to create 20 years life expectancy. There's something else in the numbers. There's something else going on. I think that as I begin to understand this more, I understand that data sets in those other 4 census tracts were replaced by model data from other places that looked like it. There's a lot of 911 addresses. As you and I both know, Adair County's. My mom's address is not a 911 address. It would have been an address that was thrown out. Those are lots of things that come into play. But what we are doing is Dr. Grimm mentioned that we've been working with the Lynn Institute. And next Tuesday afternoon, after the Lynn Institute presents at the NORA conference, we are sitting down with them to discuss this. They have a team of scientists and investigators who do this kind of thing. I asked her to review the articles, review the information we've come up with, and to sit down and start to have a conversation about where we would start in doing a project like they did in Oklahoma City. Where would we start? And not to just look at that one area, but then start looking out throughout the other counties within Cherokee Nation. Because when we do write grants and we do write for funding, I think the reason, it did shock me, I will tell you, it did. But the reason that I think that as we began to understand the numbers a little more, that we were a little less startled is because we know that we have a lot of vulnerable, what are classified as vulnerable populations, not just in Adair County, in Cherokee County, in Delaware County, in lots of counties throughout the entire United States. There are designated vulnerable counties and vulnerable populations, and we have been looking at those. And so we do plan to dig deeper on this particular issue, but at the same time keep up the efforts throughout all of our counties to look at those primary causes of disease and the social determinants of health, and be especially cognizant of the numbers and the information, and find out more every day of what we can, of what it means.
So this is a sound study. I've heard that, like you said, if you drive a few miles
Right.
and it changes, that don't sound real sound to me. I mean, if we're going to talk numbers and put it in the Washington Post, these people are in some other state. I don't know what time it is there. They might still be in bed, But if you're gonna call something sound, let's get these numbers right. Where if you drive a few miles, that the numbers make sense. This is not making sense.
Right. And one of the things I thought about immediately is that since this was a publicly funded study, they published it, and I know that the authors of the study probably did not talk at all to the authors of the Washington Post. They picked it up, dug through it, got some information, and ran with it. And so I have still not been able to reach the folks at the Robert Wood Johnson Foundation. We plan to speak with both them and some of the CDC folks to find out what exactly their take is on it as well. And I think it's important also for us as a public health department to also express CDC and Robert Wood Johnson can't do anything about someone picking up a publicly funded
Right.
study and running with it
Right.
and writing an article, but they can take into consideration what this does for small populations when it's not carefully analyzed and when it's not put in the press as it should be, that there are consequences to
So
that.
Lisa, now you guys are gonna find out. One of the main priorities is making sure these numbers are numbers that we can use, right? So that's gonna be in your conversations coming up.
Absolutely,
So that'll-
absolutely.
That'll make me feel better knowing, that if these numbers, are correct, like I said, like you and I were saying, if you move to Bell, you're gonna live longer, and see.
It's not
Yeah.
inaccurate, just, yeah, I see what you're saying,
I'm
yeah, I know what you
I'm
mean.
interested in your next meeting, and when we can say, all right, Sean, here's the numbers, and they're bad,
Counselor Warner, who serves as an at-large delegate on the CDC Advisory Committee, and we as the Public Health Department support him in that and give him technical assistance, and this will definitely be on the agenda at the next meeting to discuss.
Well,
We're going to put it in before the next CDC Advisory Committee and ask for a response from them as to this information.
we got, thank you, and I appreciate you guys, and I'll look forward to the next meeting. All right, I'm done.
Councilman Warner.
Yes, sir. Thank you, Chair. That's what I was going to say. I mean, if anything, this is, when you look at, I've had a couple of statistics classes, and I mean, statistics are tricky, especially if you've never sat in them, psych stats, business stats, intro to stats, you name it. You can manipulate things, and you have to know, though, what is the author, what were they actually looking for, and I think that helps us dig. But what it does, where there's smoke, there's fire, typically, and I don't think it's, for me, I've looked at a lot of stats, and our neck of the woods being eastern Oklahoma, South Oklahoma, we have a landfill of our own, we have several water, all the water that runs from up here ends up down there dumping into the Arkansas a lot. But it gives us more of a, a box to stand on, if you will, for public health and what this committee can do and what we can do moving forward. Some of the other tribes are looking, the Choctaws are doing more in public health. So I think when we learned the other day, clinical side, that's 20% of the human body. We need to look at the other 80%, and I think this if anything, this brings a spotlight onto that area to where we can take it to the CDC and to other places where we can pull in that funding, where we can help get that public health infrastructure that we need. Because if we don't have that infrastructure, and that's boots on the ground, that's different folks, and that's doing these different things, they can, CDC can come up with a grant that could be specific for our area, and to combat a lot of these things. But it also helps you start to build a platform of, what are we going to do to change this? And it's up to each individual, not just our public health owns this or our clinical side, or everybody collectively has a stake in this. What do you do under your own household? What are you cooking with? Are you going to leave out a little bit of salt tonight? I mean, it's a minor thing, but that's one start for the future generations. It's nothing that we cannot change, but it can't be instantaneous. It has to, and that's where I appreciate you guys looking and digging into this and to helping all of us understand. I think this is another good discussion of what is public health, because they're looking at these studies and they look at all this different stuff. What are they trying to define? What are they trying to show us? And then once you understand that, I mean, I heard they're looking at new methodology on how this is new stuff, the way that they want to look at this, so that, and they were happy that it showed something. Because if, when you look at statistics, if something is not greater than or less than 5%, it's not significant, and you get into all this jargon and this different things. So there's a lot to understand, but what it has done is it spotlighted this area that is in the heart of the Cherokee Nation, and we have a high dense population of Cherokees, which we know we all can get behind that idea of helping that out. But I think the future, it's up to every one of us to get out there, but this helps build that, and having that understanding. Your people are going to want to know what's going on in that area and the different things that they can do. And they're gonna want tips. People love tips. Let me give you 5. How many articles do you run across? 5 health tips that will help you live longer. And you read through them and you go, well, I already knew that, but hey, do you remember? But it's reinforcement. It's like going in and taking continuing ed classes, or getting those refreshers, updating. So I think we're moving in a good direction. Thank you.
Counselor Shaw.
Well, I have to applaud everything Brian just said, because he's absolutely right. And I'm glad that we have the Public Health Division taking the lead in this immediately, and grateful for it, very much so. I think we're a step ahead by having that in place, and thank God, even if the funding has been limited, that we have it. And, I would encourage everyone to remember this when it comes to budget time, that perhaps we should enhance our funding. Because I'm alarmed to realize that more people died of influenza than car accidents last year. And, I can just pray that we get everybody immunized and more information to those who are allergic to the flu vaccine. I mean, I'm so tired of that excuse myself. But I think it's important that we get that information out there. And I applaud what you're doing, appreciative of it.
I do too.
I have to just add again, I don't know this for sure, but I can't imagine there are hardly any tribes in the nation whose legislative body have created a public health subcommittee to start dealing with things at a policy, legal, population-wide, sort of basis. And our health clinics are just as important, but focusing on some of these broader things across our entire population base is so important, and you've taken a step by creating this. And I will add, and I don't know that this is true, but I think you all know I'm an optimist, a realist, but an optimist. I'd like to think, because of the things we do as a tribe and the fact that we have this nice clinic, in Stillwell for our people when they do get sick, when you look at the population, it's 50%. I'd like to think maybe it's the other 50% that's not making it as healthy, and that we're the healthier ones now. But what I'll say is the public health side of things affects the whole community, though. When we do something at a school, it affects everyone in the community. When we work with the town to do something, it affects everyone in the community, not just those people that come into our clinic. So, those kind of efforts that we do as a tribe, help the entire community too, our public health efforts. So,
Well, I appreciate you guys looking into it for our area. And like I said, Lisa, I'm not ready to accept that the way you and I grew up is the worst in the nation. I'm not ready to accept that because somebody who can't get their numbers straight, 50-something, in Stillwell, like you said, you moved to Bell, you're gonna live 70.
yeah.
I love all of this. This is a great, great committee. I love this. It's preventative. But I'm not ready to accept that. I'm not ready to accept
That's the first step.
these numbers. What?
That not ready to accept. And
Well, what I'm not ready to accept is 56 in Stillwell, these numbers from a sound study, and you drive to Watts and you're going to live almost to 80. We've got work to do, but my people, it's almost painting them in a bad light. Here, you better quit smoking, you better quit cooking this, I need that information that you guys are going to get to be different than this. Do you think that's ridiculous? The 56 in Stillwell, then you drive to Rocky Mountain, it looks like, and you're going to live 20 more years?
There's obviously something else
Get
going
me
on.
some
So we are
better-
digging. We're
Right.
digging, and we're going to come back with, it may take a little bit. I think our conversations with the Lynn Institute will give us an idea of what the direction to take next, but we're going to continue to dig.
And it's all good on you guys' side, in this committee. So thank you for what you're doing. I'm kind of a little not ready for that just yet, but my negativity's toward that, them saying, not you guys. Thank you.
Counselor Taylor.
I just want to say up front, I think the numbers in tracks 3 and 5 are completely inaccurate. They said up front that they have substituted those numbers, and I think that's a poor representation. I am shocked that 56 is the estimated age in Stillwell. But if you look at our own information that you give us every month, the top 4 visits to our clinics are for treatable diseases that go right along with these statistics. And I have to think that Lisa said, finally, somebody's listening to me, because it is education and it takes a long time to turn around. You know, I've always eaten donuts for breakfast, but you can eat a banana for the same price, you know. And so it's a matter of educating people on what we can do, and we've got to own our health.
But that's
And
nationwide,
that's-
in every district, right?
You know, the top 4 diagnoses are exactly the same at Sam Heidler as they are
Right.
at Wilma P. The hypertension's #1 across the board. Diabetes is on every one of them, I think, and so it is. And there are lifestyle changes that we've got to figure out how to get our people to make. So keep up the good work. That's all I have.
Thank you, Councilman Dobbins. Yeah, this information is highly disturbing. Yeah, there may be some inaccuracy. Lisa, how long have you knew about, well, Dr. Grimm, you mentioned on some of the grants that you guys write for, you guys have used Adair County to get some of your grants. How long have you guys used them as an objective in a grant?
I would probably say it would depend on the funding opportunity. Every funding opportunity has a different target and different specifics, but I have known, as long as I have worked here, which will be 28 years in May, that there are particular counties within the Cherokee Nation Reservation that have been designated vulnerable populations.
Okay.
And Adair County has been in that for as long as I have been working here.
Okay.
It takes
And,
decades to change.
Sure, it does. And with saying that, you know, I don't like to rely on the federal government and funding to take care of our people. Unfortunately, you know, we're 70 or 80% dependent upon the United States. But the tribes have came a long ways with leveraging their sovereignty and their business development. And, you know, it convicts me, as a Cherokee citizen and also as a Cherokee Tribal Council member, on our priorities in our tribe. You know, I know we've became a business over the years, but, you know, it goes back to the old saying, put your money where your mouth is. You know, and, you know, seeing our health statistics, I'm curious of how much discretionary money have we put into helping our people live longer. We've used a lot of federal dollars, but how much discretionary dollars have we used in saving our people? And, you know, I look at our wellness center we have here in Talco or Marcoma. You know, if that was never there, a lot of those people would not go work out or go get up 6 in the morning and go run, and they would have no education on how to eat healthier and so forth. But since you guys made that available here in the heart of Cherokee County, Cherokee Nation, of thousands of people have flooded that facility. And, you know, it goes back to your priorities. You know, Choctaw Nation, I would say by their action, one of their priorities is wellness. Because they're putting wellness centers off, they're flooding wellness centers throughout their whole jurisdiction. We're flooding our whole jurisdiction with casinos. We just spent $55 million on a new one just down the road. You know, and, you know, so there's a lot of different examples. You know, put your money where your mouth is. This doesn't affect you guys. I'm saying this as a legislative body, the executive branch, the Cherokee Nation as a whole. You know, we need to be looking at saving lives and increasing life expectancy. And I'm convicted as a council member because I'm guilty as well, because I haven't pushed this tribe and our administration to go in this direction. I've talked about it, but I haven't been passionate enough to just keep pushing and pushing and pushing. And so, anyways, Chair, that's all I have to say. But you know, I appreciate you bringing this to our attention, because I was a little bit confused. I thought it was more of an air quality thing, but looking at the data, you know, with heart disease and so forth, that's preventable measures that we can do in our behalf of wellness and eating habits and so forth. So, anyways, that's all I have to say.
Let me add that you all have done some things for us too. You know, the Marcoma is a gen fund, you know, funded program. 5%, you know, of the tribal dividend, you know, from our businesses comes to our contract health services. And then recently, you know, we put, as a tribe, you know, from our businesses, $100 million, you know, into our health facilities to try to expand them. Because even though that is not necessarily on the front end that we're talking about right now, there's a lot of public health activities and prevention activities that go on inside our clinics. And expanding that infrastructure is going to have long-term effects on the population too. So, you know, I do believe we've been putting, you know, our money where our mouth is, besides just the federal dollar, you know, as a tribe.
Well, and Stillwell is where I'm focusing on, and those are discretionary dollars is for health care, not wellness. That was my point.
Okay.
Okay, if I could, as chair, I have four fellow counselors that still would like to ask questions. If I could just push pause for now. Lisa, did you have any other thing to share with us?
On this topic, no, other than just to say, I think what this is, we're conveners. Cherokee Nation is a great convener of people. We hold a lot of influence in communities, and I think this just helps us to convene more people to the table to talk about issues and work forward. And we appreciate everyone's support.
If you could stay around after the meeting.
Absolutely.
Okay, Dr. Graham, just stay put. Dr. Montgomery, you're going to come and share with us about the opioid crisis with us.
Didn't have any prepared comments. I'll just say real quickly, nationwide we have a serious crisis, and Cherokee Nation is not immune to that crisis. And I think you're all aware that we have a problem with prescription of opioid medications, and it's affecting our population, it's affecting our tribal citizens. In recognition of that problem, a couple of weeks ago, I recommended the formation of an opioid response task force. There's a variety of different efforts, different influences being brought to Cherokee Nation, and I felt would be best coordinated by a central group. And that's what the Opioid Response Task Force will be. It's headed by Dr. Nolan. I've asked Dr. Gann to serve on it. Rhonda Cochran is on it, representing the administration and the clinics. I'm blanking on the other members. Dr. Gann, can you help me? Career Services and
Attorney General's office.
and the Attorney General's office. So we'll keep you updated on the actions or recommendations that come from that task force. But again, I felt that it was an important response, that we coordinate our efforts system-wide across disciplines to try to find strategies and solutions to this problem. The other important thing to make you aware of, the Oklahoma legislature passed important new mandates, laws, legislation influencing the prescribing of opioids that's going to affect our providers and our tribal citizens. And I've been working very hard with all the clinic directors. I met this morning with the primary care physicians at Hastings prior to this meeting in anticipation of these new requirements on the prescription patterns of providers. So just know that there's a lot going on that I'm trying to coordinate. And again, the Opioid Response Task Force was a decision I made that I thought would be very important to try to coordinate these efforts. Behavioral health, pharmacy, et cetera. The effects of these changes are widespread throughout the system, and I'm working very hard to address this and come up with good strategies and solutions that will help our citizens.
Questions for Dr. Montgomery? Counselor Shaw?
One. Dr. Montgomery, the next time that you are here, would you please share with us how, on this opioid epidemic, the casualties of this, if it's because too many opioids are ordered by our medical profession, or if these are illegal drugs? You know, my concern is that the legislature has gotten involved now, and they've created all of these restrictions now upon our prescribing physicians, and that people who are in serious pain are not receiving the medication perhaps they deserve.
I will bring you that information.
We've got our government telling our doctors how they're going to write medicine, in case you all aren't aware of that. And I think that's something I'd like to hear in the future address, okay?
I think your point is well taken. I think we may be transferring the problem from prescription medications to illicit medications. There is no doubt that that's going to happen. And Dr. Gann just shared with me yesterday, I think we have the overdose data that we can share with you that, again, is not, it comes up to, I think, 2012, is that correct?
2012, 2016.
And so, yes, this is data that we can share with you at the next meeting.
Thank you.
Yes.
I just want to know if are they tightening those restrictions or loosening those restrictions from the
Very
state
much
legislature?
tightening them,
Okay.
yes.
All right, thank you.
Very much tightening them.
And we've been working, Dr. Montgomery's also had a small task force separate from the opioid response one that has been working on with our providers how across the system we're going to deal with that. You're going to be hearing more. We'll keep you informed more about that, but it is going to restrict what providers, or it'll restrict, but it also puts new requirements on what we have to do with our patients. And so we're working on that right now, how we're going to do that as a system.
I may just as an example, for acute pain, you can only write for 7 days now. A doctor in the past could write for 2 weeks, a month, whatever they wanted. But the new legislature mandates that the initial prescription for acute pain be for only 7 days, and then there are requirements on the subsequent reissue or renewal of pain medication, just as an example. So yes, there are much more stringent mandates on the prescribing patterns of providers. Good question. Anything else?
Anything else? My apologies to Counselor Buzzard, Counselor Hatfield, Counselor Austin didn't get to ask their questions. I'm sure you will.
No, my comment was on the other subject, so I'll just wait till next time.
Okay. Okay. No old business, no new business, announcements. I'll entertain a motion to adjourn.
So moved. Second.
Next meeting, December 17th.